I'm Darren Cabo-McCauley, DO, founder and chief executive officer of Concierge Medical Cannabis. Today we're going to be discussing cannabis and cancer, because cannabis can be both an effective cancer treatment and a form of palliative care for symptoms. Cannabinoids have long been used as an effective therapy for common symptoms of many cancers and as side effects from the chemotherapy and radiation used to treat them. Cannabis can decrease nausea, improve appetite, decrease fatigue, ameliorate pain, and improve both anxiety and depression. Current research relating to the effects of cannabis on the immune system itself has elucidated a role for cannabis in the actual treatment of some types of cancer. Due to the palliative nature of cancer and its courses of treatment, there may be a greater tolerance for the side effects of cannabis, including dizziness, sedation, and somnolence or sleepiness. Marinol, a compound of THC distilled into sesame oil and nabilone, a potent synthetic CB1 agonist, were both FDA approved and used in the treatment of chemotherapy-induced nausea and vomiting and the wasting associated with HIV since 1985. So much for cannabis having no medical value. However, using solely THC presents with a greater side effect profile than in combination with CBD, terpenes, and minor composition cannabinoids. The increase in side effects is important because it makes patients less likely to be compliant with their therapy. There are dangers to smoking cannabis. A cannabis cigarette has been shown to have more tar than a tobacco cigarette. Smoking cannabis can lead to many of the same problems as smoking tobacco long-term, including chronic cough, decreased exercise tolerance, and chronic obstructive pulmonary disease. However, cannabis is not a carcinogen, and there have not been any studies that show a correlation between cannabis and lung cancer or any other form of carcinogenesis. CBD in particular has been found to be a potent inhibitor of breast cancer solid tumor growth and metastasis or spread. In vitro studies, cells in a lab, show that CB1 can regulate the ID1 gene, which is needed for breast cancer cells to grow and thrive. Because of the lack of expression of the ID1 gene in other tissues, the researchers opined that the therapy would likely be safe and effective for human patients. Breast, pancreatic, and hepatic carcinoma in particular have been shown to be inhibited by CB2 receptor activation preferentially. This speaks again to the caution of using primarily THC-based products. Patients do have a tendency to seek THC-based products because of the cognitive effects of THC and the fact that those allow patients to self-titrate more appropriately. However, CBD's effects as a potent anti-inflammatory and as both treatment and preventative agent for tumor proliferation make the case that CBD should be used on its own in both patients of cancer and perhaps in a healthy population with other risk factors for cancer. Animal models demonstrate the efficacy of cannabis in the treatment of certain types of cancer and have helped with the genesis of proposed mechanisms. 50% of rats were shown to have complete remission of glioma after injection of high doses of THC. Both in vivo and live animals and in vitro, cells in a lab, studies have shown that cannabinoids can have a significant impact on cancer cells through a variety of mechanisms, including supporting the release of cytokines, including tumor necrosis factor. They stimulate apoptosis or programmed cell death of cancer cells, autophagy or cell death for renewal, and they inhibit angiogenesis or blood vessel formation, which is necessary for both tumor growth and metastasis. Despite promising research for cancer treatments, the value that cannabinoids bring to symptom relief can be overshadowed by placing faith in cannabis as a sole form of treatment. It is dangerous for patients or practitioners to shun accepted means of cancer treatment in lieu of cannabis or its products. The dire predicament that patients and practitioners are in should help to spur ongoing research and exploration for treatment options. However, until there is scientific consensus, Cannabis is at best an adjunct that can provide symptom relief. Any other effects ascribed to cannabis therapy for cancer can be dangerous. Thank you for joining me today in our discussion of cannabis and cancer. Dr. Darren Cabo-McCauley and Concierge Medical Cannabis, signing off. See you next time.